the big issue early was PPE. My goodness, that word was said 10 billion times a day. First of all, it didn't have enough, which was outrageous, and people are reusing masks and gowns and everything you can imagine. Where are we now? Do we now have enough stockpile, enough inventory where doctors and nurses and other healthcare providers are going to be safe, which means that their patients will be safe? Where do we stand?
Well, I'm concerned that we do not have enough all over the country. In Connecticut and at Yale New Haven, we've been very lucky. First of all, we're a very large health system, and we had a lot of stockpiles, and we've been able to procure PPE, but it's extremely expensive. Sometimes we're paying 10 times the amount that you would for a normal mask. Forget about it, N95. And we develop processes to re-sterilize them. But that's not true. Our safety net hospitals that are running on a dime, and our rural communities and our smaller institutions don't have that deep of pocketbooks, and they aren't even able to procure it even if they could. So this is a major concern. We should have a national strategy to make sure that there's enough PPE for everyone. This is like baseline things that we could be doing right now to protect everyone, the staff, the patients, their families, and enable us to keep open.
Talk to us about what you're seeing as far as personnel and how this has been affecting people coming to work, not wanting to come to work, nurses, we're in a nursing shortage on top of all this. This is a real mess.
You're right. It can be a mess. And we are here as the frontline responders, and we are going to be here. We have lots of challenges. Number one, emergency staff, nurses, doctors, secretaries, everyone. We usually came into work when we were half dead. We would never stop coming in to take care of patients. We can't do that anymore. Any single person that has the least bit of a cold, a cough, any of the symptoms that the population understands that could be COVID, we need to take them out. We take them out. We try to get them tested very quickly. And if they are sick, we have to keep them out according to the CDC recommendation. So we have to have a really large depth of providers. The nurses are really at critically shortages throughout the United States. That was happening pre-COVID.
Sure.
But right now, it's really difficult for them. They often have young families. They're taking care of people and older people. They're afraid to bring COVID home, as well as physicians and who are young parents who are afraid to bring it home to their young children, as well as to their elderly parents. So we need to protect everyone. And so we work as a team. That is the most important thing. We found that stress was much more reduced when we worked as a team and took care of each other while we were at work and when we were at home. And that's really the secret of our being able to stay up well and take care of the public, which is really what we are here for.
Well, Dr. D'Onofrio, it's great talking to you. I am honored and pleased and grateful that you and your colleagues around the country are hanging in there in a very difficult time. It's frustrating because we as doctors know that there are solutions for this, and people are not either believing in the solutions or not helping with the solutions, but we still have a mission to help people and do the right thing, and you guys are putting yourselves and your families' lives at risk, so we thank you for that. And please come back and see us again.
Thank you. Thank you. We know that if you prepare for an emergency, there will be no emergency, so we are going to be right there.
That's right. Stay safe.
Thank you.